Welcome back to AM Northwest. You know, cancer treatments don't just take a toll on your body, they can also damage your teeth. Here to share some important information, we welcome back from Sleep Dentistry Defined, Dr. Heath Lampee. Good to see you.
Thank you so much, Helen.
So there are all different kinds of medications and treatments that cancer patients go through, and you say some of them can affect their teeth.
Yeah, so the three main ways to treat cancer are surgery, chemotherapy, and radiation.
Yeah.
It seems to be the chemotherapy and the radiation that affects the teeth the most. Chemotherapy can obviously make you lose your hair,
right.
but can also cause a lot of vomiting, throwing up.
Oh, right.
And so all that stomach acid coming up into the mouth really softens the enamel. So that can take a big toll in basically removing the minerals from the enamel, making it very soft. And a lot of times after cancer patients have that sort of vomiting, they will actually brush their teeth right afterwards.
Well, because that's what you want to do.
Yeah, you want to get that out of your mouth.
Yeah.
But it's actually really bad because the enamel is soft from the acid and your toothbrush is just wearing away even more enamel.
Oh, I didn't know that.
So after that sort of incident, you really just want to rinse your mouth out, maybe with milk or water, and wait at least 30 minutes to brush your teeth.
Oh, that's a good point. Yep. Okay. But doesn't the chemotherapy in general, in addition to the vomiting, because chemo destroys bad cells, but it destroys good cells as well, right?
It can, and and the teeth are alive. They really are. So it has a detrimental effect in removing minerals from them, basically softening them up. The radiation therapy, the other way to treat cancer, can cause severe dry mouth as well. And so not only during the treatment, are you having your saliva is gone, that's what it's doing, but after treatment, once you're in remission, saliva does not always come back. So you have dry mouth, and saliva acts as basically, it washes away the bacteria that cause cavities. Oh. So if you can't wash away those bacteria anymore, those bacteria are basically munching on the teeth, which the enamel is already soft. And these patients, after cancer treatments, a lot of times, their whole mouth is wrecked. Their lives are saved. Yeah. They're in remission. It's amazing. But their teeth are not doing well.
So you've had some cancer patients in and done some work on them. What have you done for them?
So we do a full evaluation when they come in, and we'll do x-rays, gum charting, all those things, photographs. And so a lot of times, if they have old crowns and stuff like that, a lot of times I'll find old new cavities underneath them.
So you have to replace the crowns,
I have to replace a lot of crowns, and a lot of times, if the teeth are really bad, we actually have to take some or all of the teeth out and do implants.
Oh, wow.
And that's how we restore the mouth to health again, but also the smile, too.
Right. And radiation, does it have to be in the area of the mouth, or can it be radiation anywhere? You said that's what causes dry mouth. Yeah,
so oftentimes it is radiation to the basically torso and above, that it can have effects in the mouth, whether it's directly aimed at the mouth or even a little bit lower. Okay. So. And
then you have a patient, Larry.
Yeah.
Want to tell me about?
So Larry came to me about 6 months ago, and he had just finished beating cancer 3 times.
Wow,
and
good for him.
It was his wife that encouraged him to come in. We talked about what we could do, and his teeth were in such bad shape that we actually had to take them out.
Oh, wow.
He was missing teeth, he had decay, he was alive, he was doing great, but the cancer treatments had taken an effect. So we took all the teeth out, we did 8 implants, 4 on his lowers, 4 on his tops, and we did our snap-in implant dentures. And in the course of 4 months, he got a healthy mouth again, got all the disease out of there, and he got a new smile and a new way of eating, basically.
Wow, that is fantastic.
Yeah. And it was funny, just a week after we finished his case, him and his wife did a month-long cruise to New Zealand and Australia to kind of celebrate.
Oh, nice. Yeah. I love that. You mentioned, when we mentioned the dry mouth and the radiation, you also mentioned too that oral rinses are a good idea, right?
Yes.
If you're going through that.
We have some special oral rinses and gels that can hydrate the mouth, make sure that the cavities and also the bacteria that are in there get washed away. So use that every day, and also high-strength fluoride toothpaste can help as well. Anything that we can do to try to refortify the enamel and moisten the mouth, basically. Okay,
those are all really good points. Okay, thank you so much, Doctor. We're going to tell folks if they'd like to find out more, contact Sleep Dentistry Defined at 503-646-2273, and we'll put that information for you on our website at katu.com. Thanks.
Thank you so much, Helen.